my channel. It's me, Simply Unique. I want to thank you guys once again for giving my channel another visit. If this is your first time here, welcome. Make sure to subscribe to my channel and hit the bell to be alerted. I will post new and exciting content every Sunday. You don't want to miss it, so make sure you hit that bell. Today, we're going to discuss PCOS. We're going to talk about what it stands for, what it means by definition, the signs and the symptoms, how you can be diagnosed with PCOS, and the treatment that is given by healthcare professionals. So keep watching. Okay, first, so let's just talk about what is PCOS? What does it stand for? What does it mean by definition? What are the signs and the symptoms? So first things first, PCOS stands for polycystic ovarian syndrome. And by definition, it is a hormonal disorder amongst women of their childbearing or reproductive age where your ovaries have small cysts that are surrounded on the outer edge. And these cysts give off unwanted or unneeded hormones that causes your hormones to be imbalanced, predominantly your androgens. And these are male hormones that we all have, but when you're a PCOS lady, they are excessive. You have more of it than your body, than you need or than you obviously want. So some of the signs of PCOS, we'll start with your menstrual cycle. It can be either absent or irregular. When I mean absent, I mean absent. Some ladies do not get a menstrual cycle at all. And when it comes to irregular, it can be, you can get a period 1 month, skip 3 months, 5 months straight, not for 6 months, or you can have a cycle of just 1 day to 3 days, or less than 2 weeks, all over the spectrum. Some ladies' menstrual cycles are just spotting. You can just spot, no flow, just very light. It just all over from the spectrum from here to there, but it's all over, just irregular. And with it being so irregular, it makes it impossible to either ovulate or pinpoint when you're ovulating. So if you are a lady trying to conceive and you have an irregular cycle, it's very hard to know when you're able to conceive. You know, when you have to ovulate in order to conceive, which is the release of an egg. And if you're not releasing an egg or don't know when you are releasing an egg, it's really, really, really hard to be able to conceive. So once again, you do not have to have an irregular cycle. This is just what the case may be. Some ladies have regular cycles but just aren't ovulating and don't know that they're not ovulating. So they may think, hey, PCOS isn't what it is for me because I get a period every month. That may not be the case. Hopefully it isn't the case for you, but it can still be possible to have a regular flow, regular cycle, but just not be ovulating month to month. So to get into the physical symptoms, we'll start with cystic acne. So a lot of ladies who suffer with PCOS, they have cystic acne. It's not your average preteen, teenage, first time acne. It's different. It's very large, it's pus filled, it's painful, it's red, it's very, very, very noticeable, very, very, very painful, and it's very, very hard to get it off of your face. And I'm speaking because I am a PCOS lady. I have had cystic acne, but I'm going to make a separate video that's going to go into greater detail of everything I've experienced, suffered with, done, everything. So that'll be separate, but I'm going to keep this in the general of PCOS ladies. So yes, cystic acne is a thing that can be connected to PCOS. Also, ladies with PCOS have hyperpigmentation. You may have areas like your neck, your underarms, your inner thighs that may be darker than the rest of your skin. That's due to hormones, and also it can be due to friction. Just like any woman can have darker inner thighs due to just the rubbing of your legs if you don't have space in between. But when you have PCOS, just due to the hormonal imbalance, your pigmentation of your skin can vary depending on the location. Secondly, I would say unwanted facial hair and excessive body hair. And what I mean by excessive body hair, yes, we all get hair on our underarms, our private area, our arms, our legs, etc., etc. When I mean excessive, I mean male pattern hair growth. Very full, very thick, very, very dark. So when you have PCOS, if you see that you have extremely full body hair, it can be due to hormonal imbalances due to having PCOS. And when it comes to facial hair, it's also a range. Some ladies may have 1 strand to 2 strands to 10, 100 to a full face beard. It all varies from person to person, but facial hair is definitely a telltale symptom that you probably may be a PCOS lady. Another symptom is hairline baldness, male pattern baldness. Like, you know, a lot of guys, when they go bald in the front area or they're losing their hairline, it's the same thing. You start to see thinning in the front of your hair, but also you can thin throughout your whole head. But it's very, very noticeable when it's your hairline. Once again, just due to the hormones. When your hormones are out of whack, your body pretty much does not know how to respond. It's pretty much in a shock, like what's going on. So things start to happen that may not seem normal to you or to other people. But PCOS is a very, very common thing that a lot of ladies don't even know that they may have or be suffering with due to just not being informed, just may not know exactly that this is something that they're suffering with. But other signs and symptoms of PCOS is definitely weight gain or obesity. Not all ladies have to be overweight. You can be thin or petite with PCOS, but the majority are overweight or obese. And this is due to just an unhealthy lifestyle and hormones. It's harder to lose weight when your hormones are out of whack. It's a lot harder than the average woman to lose weight when you have PCOS. So if you realize that you just had a rapid increase in weight out of nowhere that was very, very fast, or you're trying to lose weight and you're just seeing no decrease, contact your healthcare professional. Say, hey, mention these things to them and just see if this is something that you may be suffering with. Also, with PCOS, a lot of ladies do suffer with depression. And once again, it may be repetitive, but it's true. It's due to your hormones. Just like when you may give birth to a child, and a lot of ladies suffer with postpartum depression. That's due to a lot of factors, but also your hormones. Once you have a child, your hormones have to get back in balance. And when they're not, you have highs, lows, good days, bad days. You're happy, you're sad. So it's just an emotional roller coaster. And it's the same thing with PCOS. When your hormones are out of whack, some days you just don't know how you feel. You're just all over the place. And also that depression can be triggered to the physical appearance that you're experiencing. No lady wants to be walking around with acne or facial hair or being overweight or having hairline baldness. So that can also trigger to you just having moments of feeling really down or really low. So once again, if you are experiencing any of these emotional roller coasters, please, please, please reach out to a healthcare professional and inform them of what you're experiencing so you can get on the first track of helping yourself and healing yourself. So next we're going to get into how you're diagnosed. When it comes to being diagnosed with PCOS, there are several things that they do to pretty much narrow it down to exactly what the issue is. So first things first, that will entail with you contacting your healthcare professional and just telling them exactly what you're experiencing. Hey, I've realized acne on my face out of nowhere, facial hair, my hair's thinning out. I feel dizzy, due to just some women have increase in insulin or, told they're pre-diabetic due to like insulin resistance. And whatever your symptoms are, tell your healthcare professional and they'll know, okay, this may be it, but we're going to take a step further. And the next step would be lab work. They'll take lots and lots of lab work, but it's great because they can narrow it down to exactly what the cause may be. So they'll test your thyroids, they'll test your cholesterol, your insulin, your progesterone, your androgen levels, lots and lots of hormone tests to just determine exactly what exactly is out of whack, what's not right, what is right, what's okay. And from there, they'll know the next step, if this next step is necessary or not. And the next step would be an internal ultrasound. So it's kind of similar a little to an ultrasound if you had an ultrasound on your belly, but it's a probe that's inserted vaginally. And they do this to be able to view your ovaries to see if they are enlarged or if you have small cysts around the outer edge. And if they do see these things, and 9 times out of 10, you are a PCOS lady, and they will inform you that, hey, you may be a lady suffering with PCOS. And that's okay. If you are, it's great to know that you are. So now you know how you can help yourself. It's not impossible to conceive with with PCOS, sorry, because I have PCOS and I have a beautiful 2-year-old who is running around everywhere upstairs right now as we speak. But it's possible to have children. It's just we have to figure out how we can get things in order to be able to have children. So I'm not going to tell you can't have children. I'm going to tell you we just have to figure out what needs to be fixed so that we can have these beautiful babies running around driving us crazy. So once they do that, they will figure out how to start your treatment. So this is solely on the treatment that I was told Once again, I was diagnosed with PCOS when I was 19. I am 29 now. So things may be different. I have not been to the hospital or to my gynecologist to have anything looked at in regards to PCOS. So if things may have changed or vary, please inform me, please let me know. But from what I have been told, and still research as I look until today, it's still, they will prescribe you with a hormonal birth control. That can be a patch or a hormonal birth control pill. And the hormonal birth control is more so to balance your hormones and regulate your menstrual cycle. That way you will get your menstrual cycle every month. You will be able to realize if you're ovulating, to get you more so on a regular flow. Also, they will give you a medication if you had an increase in insulin, which a lot of women do with PCOS. They will prescribe you metformin, and metformin is a medication for people with diabetes. And that's more so to balance your hormones. If you have insulin resistance, you're more than likely pre-diabetic, and it's medication they give to kind of balance those things out. And collectively, you can take them collectively, and it's supposed to help get these things back in order. Now, you can also go to your dermatologist for your skincare. They'll prescribe you certain things, which I did, but I did not take the medication, so I'm not going to go into that, because once I read into it, it wasn't something I particularly was a fan of, due to the harsh things that it can do to the rest of your body. So I'm not going to speak on something that I don't truly believe in. But these are the things they will want you to try. And once again, I will make a separate video of my experiences with these things, if I feel they did or did not work for me. Once again, everyone is different. So if you are trying these things out and it's not working for you, or if it is working for you, great. If it's not, that's okay. Because me, I am someone, it did not work for me. And that was okay, because I just took further steps to educate myself on what needed to be done to heal myself, because I was different than other ladies in their journey. Another thing that you can do to try to help yourself is hair removal. The medications that they prescribe are supposed to try to help balance your hormones, but it's not the easiest thing. It doesn't happen overnight, a week, month, years even. It's a journey. So a lot of ladies do like laser hair removal, waxing, shaving, which I've tried all. But what I really have been enjoying is electrolysis. If you do not know what electrolysis is, I also will have a separate video showing you when I go to get my treatments, what it does, how much it costs, how it feels, my results and everything. But it is a permanent hair removal procedure that does take time. It is expensive, but the results are amazing. Hopefully this video helped you out. If there's anything that I forgot, please comment below. I speak solely off the top of my head. I speak off of what I know. I don't want to read off of a paper, because that's just that's not really natural and intimate to me. I like to speak off of things I've purposely and intentionally educated myself on. So if there's any symptoms that you may have experienced that I did not discuss, please share, because I would love to know. You know, everyone's different. You may have rare symptoms, or, you know, something that everyone does not experience. So please feel free to share. Make sure to comment below. Let's get to know each other. Let's communicate. Let's help each other. Make sure to subscribe to my channel, please. You will not be disappointed. Let's grow and glow together. Hit the bell to be alerted when I post every Sunday. I promise to stick with this. I'm very excited about this. I'm excited to help whoever I can help and whoever can help me. So until next time, bye. See you guys.